Hi, myself Rupinder Kaur, and my student ID is 129699237. Today I'm going to perform the comprehensive health assessment. So I already checked for the contact precaution, and there is no sign of contact precaution. Could you please show the 360-degree angle of the room? Yeah, okay. So, hi, my name is Rupinder Kaur. I will be your nurse today. And before proceeding, I need to check your identification. Can I do that?
Yes, sure.
Okay, could you please tell me your name?
Navneet Kaur,
Okay, and date of birth?
1986 April 4.
Okay, perfect. So, today I'm going to perform the full head to toe assessment on you. And can I do that?
Yes, sure.
Okay, so for that, I will ensure your privacy and the dignity, and I will keep you comfortable throughout the procedure.
Sure.
So, can you please tell me where we are right now?
House number 36 Powering Way.
Okay, and who am I?
You are my nurse today.
Okay, and what's the time?
It's going to 7 p.m.
Okay, and do you have any pain right now?
No.
Okay, if I want you to rate your pain from 10, how much you will rate?
0.
Okay, so while speaking, she has clear and in his speech, there is no stammering, there is no mumbling of the words, there is no slurred speech, and she is clear with her communication. There is no sign of anxiety. She appears the cheerful, and she dressed according to the occasion and the season. So her affect and behavior is normal. And could you please walk 2 steps for me? Okay. You can sit now. So while walking, she is normal, and there is no stooped posture, and she didn't use any assistive devices. She can walk by herself. So by sitting, she is sitting in the erect position, no sign of lordiosis, scoliosis. And could you please, now I'm gonna proceed with your head. Can I do that? I'm gonna check your hair. Okay. So in her head, there is no lice, there is no dandruff, there is no lesions present, and she has a good hair hygiene, and hairs are equally distributed. Now I'm gonna proceed with your ears. So the both ear lobes and ear pinnas are symmetrical and equal. There is no drainage from the ear. Now I'm gonna inspect her eyes. So both eyes are equal, and there is no redness and drainage from the eyes, and there is now I'm gonna check her perla. So I'm gonna put light on her eyes. Okay, so both pupils are equal and reactive to the light. For the nose, there is no nasal deviation seen. Her nose is symmetrical, and lips are pink and moist. There is no sign of chapped lips. And could you please open your mouth for me? Okay, so her tongue is normal, pink in color. There is no ulceration present, and for the there is no cavity seen in the teeth, and she has no foul smelling, and she has a good oral hygiene. Could you please smile for me? Okay, could you please raise your eyebrows? Okay, so her smile is symmetrical. There is no facial drooping or smile on the one side, and she has no sign of facial asymmetry. So now I'm gonna check your cervical nodes and to feel any tenderness. There is no tenderness present over there. So now I'm gonna inspect her chest expansion. Could you please take a deep breath for me? Okay, so while she has a normal breathing of work, as she didn't use the accessory muscles such as a tracheal tuck, nasal flaring, and she is maintaining a good position while respiration, and there is no tripod positioning. Her work of breathing is normal. So her respiration rate is also normal. So now I'm gonna auscultate the breath sounds. Could you please rotate for me? Okay, so when I'll tell you, take a deep breath.
Okay.
Take a deep breath. Okay, move to the side. Take a deep breath. Okay, so her lung sounds and are equal in all fields, including anterior, posteriorly, including apices, axillary, and the bases. So there is no adventitious sound present, such as the wheezing and rhonchi and the crackle. So now I'm gonna check her apical pulse for 30 seconds. And the apical pulse is present on the left side at the mid-clavicular line, fifth intercostal space. Her apical pulse the rate is 70 beats per minute, and it's regular and strong. So now I'm gonna palpate her lungs for symmetrical expansion of the lungs. Could you please lay down for me? Okay. Take a deep breath. So as my hands fall and rise at the equal time, it means both lungs expansions are symmetrical on the both sides. So now I'm gonna inspect her abdomen. For any distension and for the symmetry. So her abdomen is a flat, and there is no sign of distension is present. So now I'm gonna auscultate her bowel sounds. Okay, so bowel sounds are equal in 4 quadrants, normoactive, there is no sign of hypoactive, hyperactive, and no absent sounds are present. So now I'm gonna light palpate her abdomen to check if there is any tenderness, if there is any pain, or if there is any palpable mass is present. If you feel any pain, just let me know, okay? So she has no pain and no tenderness, and palpable mass is noted. So now I'm gonna check her extremities. Could you please move your extremities up and down? Her movement is equal bilaterally, and her hands are warm to touch, and there is do you feel my pinch?
Yes.
Okay, she has a normal sensation in that. And now I'm gonna check her radial pulse on the both sides. Both radial pulses are equal in strength and regular. Now could you please hold my hands tightly? Okay, so hand grip is equal bilaterally, and it's strong, and it's 5. And could you please okay, now I'm gonna check her capillary refill. So her capillary refill is less than 3 seconds, and there is no she has an intact skin with a normal skin tone, and there is no bruises, and there is no discoloration of the extremities present. Now I'm gonna check her the lower extremities, and for the lower extremities, could you please move your limbs up, down? Okay, so now you have to move your feet against my hand resistance. Okay, move downward. Okay, now move upward. Okay, so the mobility is equal on the both sides, and for the dorsiflexion and plantar reflection, strength is equal, and it is 5 on 5. So now I'm gonna check her capillary refill. It's less than 3 seconds. Do you feel my punch?
Yes.
Okay, so sensation is normal. So her feet is warm to touch. Now I'm gonna check his dorsalis pedis pulse on the both sides. It is regular and equal in strength on the both sides. Now I'm gonna check his posterior tibial pearls. It's equal and equal in strength and regular on the both sides. So moment is also equal. So that's it. That's about all about head to toe assessment. Thank you.